Hello and welcome. It's wonderful to have you back here with us. This is Edexlive's Education Unlimited, and today we have a wonderful panel of people here to discuss one of the most pressing questions that everybody's been asking. That's right, on September 1st, more than 10 states across India have opened their doors for schools to reopen, and children from grades 9 to 12 have returned. And might I add, very successfully at that, especially with a state like Tamil Nadu. We've had so many children and teachers come back, and it's been a truly inspiring homecoming experience for a lot of them. And to discuss a very, very intrinsic topic, back to school, how do we keep our kids from getting COVID? That's right, it's a question that is on every parent's mind. It's a question that's on every educationist's mind, because such is the loss that we've suffered over this last 17 months that the pandemic has ravaged us, that it's almost impossible to believe that here we are today, most of us vaccinated, thankfully, at a good place where this pandemic appears to be in recess. And to talk about the way forward, to talk about what we can do to keep our immunity up, to keep our spirits from sagging, and to ensure that our schools are full of healthy and socially distanced and sensibly smart children. I have with me today a wonderful panel of experts. I have with me Dr. Srinivasa, Raghavan, who is joining us from Bala, Vidya, Mandir. He's the principal, he's an educationist, he's been abroad for a good many years. And his latest assignment here, he's been with BVM for 8 years. Thank you so much for being with us. I also have with me Professor Natarajan, who is an expert in Indian medicine, all forms of Indian medicine, and he's contributed to some of the most path-breaking, might I say, amalgamations and transformations of Indian traditional medicines, things like Abasura Kodinir and Nilavemba Kodinir that all of us have sort of had to tide over not just COVID but dengue in the past as well, and to bring it into tablet form and syrup form and into consumable forms that all of us can use in a very easy way. I suppose I must thank you, I think, for keeping us all and our kids also safe. Thank you so much for being with us, Professor.
Thank you.
And I have with me Dr. Chella here, who is a physiatrist, and he's joined us from Tirunelveli, and I'm very happy to have him with us. He's somebody with a wealth and a ton of experience with both rehabilitative medicine as well as he's a physician par excellence, and he's worked with adults and children alike. And he's somebody who has a very unique sort of insight into how children work, how the world of medicine works. And he's very on ground because he's been practicing in the heartland, and he knows how, the psychology of children is. And I'm very glad to have you with us. Thank you for joining us, sir. We're very excited also to have with us today Arun, Kannan, who's joining us from the USA. He's an immunologist and a T-cell biologist, and he's done some very exciting work over the last decade. And he's been at Cornell, he's been at Penn State, and he's now at Johnson & Johnson, where he's doing a lot of cutting-edge research on some of today's most pressing immunological concerns. Thank you so much for being with us. It's very important to ask a very basic question, and I think Dr. Raghavan would be the best placed to answer it. So schools have opened. It's been 10 days with holidays. I'd say about a working week. How is it going?
See, what we have experienced is first joy in my child. After 17 months, we are seeing them continuously for 10 days. That's one of the interesting things that we have noticed. So I really thank God for providing this opportunity. And if you see that so far the things are in place, under control, and people are very responsible, in the sense children are more responsible. It is only our lack of trust on them before opening that matters a lot for all of us. That confused us. Okay, but children said and done in the class 9 to 12, they behave well because they also know that it is their health. Okay, and they have understood the responsibility not to spread as much as possible. But we have also provided them some insight, and they are adhering to it. Parents are happy. We are seeing about a variation from somewhere from 85 to 95% attendance in these 10 days constantly. So that's a welcoming sign. And
I think it's interesting. You said parents are excited, but on one hand, we're still not at the point where we can say compulsory education. In fact, the government has said that attendance is voluntary, which means if a parent gives written consent is when the child can come to school. And I think across the board, from a lot of conversations I've had, I've realized that children are excited to be back in school because I think the pandemic has been tough on them. But this whole thing of children being excited versus parents being very worried, what impact is it having on the child?
See, if you see that parent standpoint is that the safety of the child, which has to be respected.
Obviously.
But at the same time, we need to take the children's mindset also a lot, because psychological balance is much needed for the children. And if this continues, then they go into the shell. Okay, so in that way, both the points from the parents as well as students are welcome. But as you said that in SOP also, there is no stringent guidelines on, or the government doesn't mandate the child to be attending the school in the bracket that is specified or permitted. In that way, schools are also a little liberal in understanding the situation of the parents' inquisitiveness or the worry, whatever you call, and at the same time enabling the child. Say, for example, in some of the classes, the number of students turnout on day 1 was less, but day 3 was higher, because some parents, they wait and watch. Okay, so that is acceptable. But that wait and watch will not continue for a longer period of time. They want to see how the trend goes, and they want to be a little careful. Fine, when we do our job well, when the children behave well and the society supports well, then it may fall into the right track.
Dr. Chellakumaraswamy, I mean, you're somebody who's been working with the community for so many years, and you've been seeing so many people through this pandemic adhere to SOPs, maintain protocols. You see people not maintaining the protocols. Today on the roads, we are in Chennai now.
Yeah.
When we go outside, you and I both know how many people don't wear masks, how many people wear their masks here.
Yeah.
How many people don't bother? I mean, we say 6 feet, it's really
Distance.
not practical in India. Unfortunately, that's the case. Now, with children in a controlled environment, how easy or difficult is it, do you think, to maintain these SOPs?
Okay. We take it as a viral disease. See, this condition, this pandemic, it's exclusively viral disease. We need to go with one criteria. So we, in spite of SOPs has been formulated and has been told, following it very strictly among the educated population, among the college goers or among the teachers, it's very tough. And following it very strictly with the institutions and organizations or factories, it's mandatory. People make it mandatory. But for the school children, as of now, we have started for 9th, 10th and 11th, 12th standard, four standards, students are coming into the school. Making them follow the strict protocols, strict standard operating procedures will be, as such, what I feel is that it's easier in a school environment, inside the school environment. But it's not alone the only area where a child can get infected. Say, the child has to come from home, they have to get into the bus or a vehicle. It can be a public vehicle or a school vehicle or a private vehicle. So they have to get into the school. Where
not everybody has the luxury of having a private vehicle,
true,
especially in a state like
true,
Tamil Nadu. And I think that's a very good point.
So these are the areas where SOPs cannot work. Say, we can say, but being a children, they may not be in the exact situation, always conscious about what are the procedures to be followed strictly. And once they come into the school, we have a very controlled environment where teachers can guide the students, giving them the space, adequate spacing, making them use the mask and use the sanitizer or soap and water. Basic things can be followed. But even inside the school, there are areas where children will be having a very close contact. Say, for example, during the intervals, they need to go to have a drinking water. There is a possibility that there is a crowding possible. Even one child, if is infected, can spread it to others. So it can be in a restroom, in a toilet area, where children clump together. And we have a time of only 15 minutes time. Say, I'm just talking practically. So within that time, everyone will be going to the restroom and coming back. These are the areas we need to concentrate. To follow the SOPs, we have to break it into small pieces. So these are the points we need to be focusing. Say, addressing the schools and institutions, make them provide say for 9th standard, for example, just I'm giving you a small example. 9th standard interval time should be 10 to 10:15 a.m. For 10th standard, it should be 10:15 to 10:30 a.m. So time can be spread out so that the interval time there is no crowding happens in the water, say drinking water area or in the restroom area or during the lunch hours. So for lunch can be for different timing for 9th standard students. Even if possible, for every sections, say 9th standard A section, particular timing for lunch hour, And providing, say in a city environment, it's very tough to provide a very spacious lunch room, lunch hall, or plenty of restrooms also. Say current day, about having
space is a premium. Yeah, we know this. Yeah.
So restroom, providing the students more restrooms, more spacious, more ventilated areas, and these are the small things which need to be concentrated.
Which has been the most difficult SOP that to enforce among children in these last say 10 days?
See, different school adopt different models. That is based on the facility available, they adopt different models. Some schools, they alternatively bring their children, say one class, say 9th and 10th today, 11 and 12 the next day, subsequent day. So 3 days in a week they visit the school. This is one model. Certain other schools, what they do is they take certain subjects alone in the school for maximum of 3 hours.
Okay.
50% they come in the morning and 50% they come in the afternoon. And they have also given separate rooms, say morning session one floor, evening, say afternoon session another floor, so that the spread is
Contained
to
a certain
okay, and even allocation of toilets. This particular section use this particular part of the restrooms in the school, so that so all these things we give guidelines. Okay, but as you rightly said that can we have what you call complete adherence inside the toilet? Okay, flushing of toilet. We may provide all the facility, but the thing is we have to ensure that hygiene part of it is taken at most care.
Every now and then.
Yes, that part of
very
it.
Important part.
That part of it is also one of the major concern. If that is a spreading factor, then we need to pay attention to that. Okay, so ventilation. Certain schools have got good ventilation, but certain other school, because of its locational disadvantage, ventilation is minimal, because surrounded by the buildings, high-rise buildings on all the sides means then you may not have, you can keep the windows open, but the thing is there will not be ventilation. So each school should evaluate their facility
exactly.
and adopt a different model to give the best effect to the children. Okay, if you have everything but it is not supporting this particular situation, means we have to, as the leaders of the school, as a responsible academician, we should not open the school. Okay, we should take the bold decision not to open the school because your facility doesn't match the requirements. Okay, that call has to be taken by the educationalist or the academician. Okay, so if everything is there but I don't open the organization or the school, means that is also a decision that prevents me to provide that opportunity for children to experience the joy once more. How long is a question, but the thing is, aren't we responsible to provide that joy? Okay, so that's also a question. So SOP is published, but effectively how far we go through the SOP and evaluate our own organization, and we need to, are we consulting with the people who understands the dynamics of the organization? That's very critical.
Professor Natarajan, one of the most key discussions in all of this is when the pandemic started, people were talking about immunity and they always thought about adults. When you say immunity, you think about people who are 45, you think about people who are 60 because they're the most vulnerable community. Yes. Children were only an afterthought, unfortunately. Maybe because they thought children would be able to handle it better. Not too many children have been infected. If you look at India's numbers, they're still very promising. They've not been very severely affected. In fact, cases among children only started coming up in the last second wave, a little bit here and there sporadically. We heard of one home in Kilpok that was entirely infected, and we've had a few clusters across India. But from a very layman's perspective, how would you rate the immunity of the average Indian child, in your opinion, as a clinician, as somebody who's worked extensively with Indian medicine and across the board? How good or bad is the immunity of the average Indian child?
See, generally our Indian children are much more immune compared to the other countries or other developing countries, because our Indian diet is such that it has inbuilt immunity boosting herbal ingredients. They are part of our regular diet. So definitely they are, since being part of the regular diet, the immunity is generally good enough, not bad. That is why even this COVID-19, the children are not much affected. So though they are carriers, actually, they are being infected because their family members are affected, means children definitely will also get affected. But only thing, the symptoms, they are most of the time they are asymptomatic, or even if their symptoms are very mild. That is why, a lot of hospitalization or death or something.
Is that because they're children
Yes.
or because their immunity is good?
See, because they, especially this COVID-19 has not affected them, or this infection has not caused severe symptoms in the children, for two reasons. That type of infection itself is something like that. Secondly, even the children could be more immune towards that particular viral infection, because immunity is always, generally innate immunity is there, non-specific immunity is there, and the specific immunity is there. So probably the children are more non-specific immune to COVID-19. So unlike common cold influenza, especially during the rainy season or winter season, if you see the doctor's chamber, always flooded with the children, right? So a lot of children go to the hospital, parents take them to that. But especially this COVID-19, fortunately, has not affected the children much. Maybe their immune system is strong enough towards or against this COVID-19.
What I'm coming to say is that get the children vaccinated as quick as possible. Say 12 to 18 years age group, get them vaccinated. Less than 12 years, the angiotensin converting enzyme is not there in their body. So we can take some time, extra time.
But our under 18 vaccine is not yet it's really very nascent at this point. And I don't think, have you encountered many of your students being vaccinated at this point?
Since the age group is 18 plus,
Yeah.
okay, so percentage of children, those who have completed 17 plus getting vaccinated is almost nil.
Almost
That's the status what we are having.
One more reason I would like to just share.
Please.
Because for the children, to have a little more immunity toward this COVID-19, possibly that their, the thymus gland, it's a very important gland. It belongs to the lymphatic system. It is very important because in children, the size is big enough, and these immune cells, especially the T lymphocytes, they get matured. They produce in the bone marrow, but they need to get matured in the thymus gland, because which is just in the chest, just along towards nearer to the sternum area. So since the thymus gland is big enough, enough T cells get matured. So the T cells presence is very important to create more immunity. Even the B cells, specific immunity, can get activated. So maybe since but as a person grows, as a person getting age, the thymus gland getting shrink, the size is getting reduced. So the T lymphocytes getting matured, possibility becomes less. Thereby maybe the immune level toward the specific COVID-19 also becomes less. I think that could also be a possible reason for children having more immunity towards COVID-19.
Looking at how the various variants of the coronavirus have been coming, and the world, of course, is dying for information on what the next variant is and how dangerous it could be for children, what are some of the things that you're sort of in touch with, and what are some of the discoveries that you think will be pertinent? And how do you think this will work in an Indian context? I mean, how is the virus evolving, and how dangerous or not so dangerous is it for Indian children?
Thanks for that kind introduction. This is a key question, right? That's in the front and center of the scientific community. Before I answer this question, I just want to quickly contextualize the difficulty we're facing. Viral infections, including the SARS-CoV-2, which is responsible for the current COVID-19 pandemic, are particularly hard to treat for two reasons. One, viruses can spread and mutate rapidly. For instance, as you alluded to, in the case of the COVID-19 pandemic, there are now 4 strains of the virus, including the recent Delta variant, that's distinct from the parental strain that was identified in China. Two, there is an added layer of complexity around the fact that most viral infections also results in an inappropriate immune response, resulting in inflammation that can, in some cases, cause fatal organ damage. In the case of COVID, we know there can be lung, heart, and brain damage. So a productive antiviral therapy requires a delicate balance between supporting the immune system to fight the virus while protecting against overt inflammation that can be extremely harmful for us. What's troubling is that this recent Delta variant has resulted in a paradigm shift in our understanding of how this virus affects different age groups with significant increase in the number of infections in kids. This is very different from what we had seen with the previous variants. Now, we know the Delta variant is a lot more infectious relative to its predecessors. So at this point, it's unclear whether the increased infections in kids is because children are just more susceptible to this, specifically to this Delta variant, or if this is just secondary to the fact that the Delta variant is a lot more infectious than the previous variants. Regardless, there is no evidence to date that would suggest that Indian kids are more or less susceptible to the virus. Unfortunately, what we can say with certainty, though, is that now with the Delta variant, kids in general are just as susceptible as adults to the virus. So we have to stick to our learnings from the past year and a half or so and use multiple strategies, including vaccination, masking, physical distancing, along with disinfection, contact tracing, and quarantining to stay safe. This cannot be a one and done kind of approach. I'm a parent as well, right? So this is very personal and real to me. Like most parents, I am concerned about the increased exposure as our kids get back into the classroom. But I also recognize how absolutely critical in-person learning is to our kids' development. So I'm hoping these tiered approaches, which have proven to work, will continue to help us be safe against any outbreaks and any subsequent variants we might have to deal with.
I have a question to ask you, sir,
Yes.
because ever since this pandemic started, and you must excuse me for saying this, unfortunately everybody is an expert because of WhatsApp University. WhatsApp University is the most potent place. It has the maximum number of students and self-appointed
Yes.
professors. And every day, notwithstanding, you get messages saying, take some manjal, take some this, take some that, a bunch of things that you can find in your kitchen, put it together, boil it, COVID will go away in 3 hours. And it keeps getting more and more promising, you know. And some of it is ridiculous, some of it is backed by science. Because very often when I go online and I search for it, you know, just to check if these things are true, they claim to be based on ancient Indian science. But when you actually go back and look at Ayush's guidelines, many of these things are not ratified, they're not verified. So what is it that is actual Indian medical science, sir? Immunity boosting for children, what is actually science? As an expert, could you tell us a little bit about what is actually science and what is myth? In all of these forwards that we get, you know, do A plus B plus C and boil it for 6 hours and drink it, keep it under the new moon, keep it under the half moon, drink it. You get so many of these forwards. Yes. Could you tell us a little bit about what is actual science and what is not? Because I think people should know what it is that they can actually do at home.
Yes.
You know?
See, to do it at home, you know, there are in official websites. Suppose if the people want to know the actual, you know, the immune boosting herbs, because diet is very important, as we all know, for, you know, boosting immunity. So, but the diet in today's scenario, it's not a complete diet. So, immune boosting herbs, if they also become part of the diet, it is actually the best thing. So that, you know, along with the diet becomes complete, enough sleep is also there, if enough physical activity is also there, it is said that people will be sufficiently immune enough. So to make the diet complete for these immune boosting drugs, people can refer the actual, you know, websites like Ayush websites.
I'm sorry to interrupt,
Yes.
but since you made this point about the diet not being complete,
Yes.
see, traditionally doctors always talk about how kids are eating a lot of pizza, they're doing a lot of junk food, and they're substituting what we've always traditionally had. In fact, I'm sure Dr. Raghavan also will agree, schools about 3-4 years ago, the government said all canteens should not have junk.
Yeah.
I think chips made their way out. Sorry to mention brands, but soft drinks, aerated drinks were no longer available in cafeterias. That was a very widely celebrated move. In fact, it's called very forward. Could you just tell me what it is that kids are not eating today that they should be eating?
See, our general food, Indian food, though we discussed that, you know, it contains enough spices or enough immunity boosting materials, but even then there are specific immune contributing herbal medicines. They can become part of the regular diet in these days, especially like tulasi, ashwagandha, lavanga, that is called a cinnamonn bark, even black pepper, or even, you know, like turmeric. So these are all, you know, commonly used materials, but people need to focus little more on that so that they become the regular part of the diet. Now, even government is also promoting a lot of medicines like Ayush Kavad or even Nilavimbu Kutinir, Kabasura Kutinir, even, you know, like Ayush Dur. These materials can become, you know, like available in the family so that on a regular basis children can be given. See, once in few days at least, these kinds of medicines, what has been recommended by the government, either from the Ayush, from the Ayurveda side, or from the Siddha side, or from the Unani side, or homeopathy side, at least one system people can follow on a regular basis, so that their children become sufficiently immune enough. So that their diet, I feel, then only it becomes complete.
What actually happens when these traditionally consumed medicines, I mean, I'm not going to call them medicines, but part of our diet, over time when people stop consuming it, what then happens to children?
So even giving them the right food, the right quantity at right time becomes a challenging task even for the parents. So then what happens, what is available, what is possible, we are forced to eat, and the same thing even we offer to the children. So over the period of time, slowly the culture is getting changed to the level that, like what we were a few decades back and what we are today. And probably if the same trend continues, what we will be eating or the type of food what we are going to eat after a few decades, probably, I feel it will get changed significantly. Maybe this COVID-19 is helping us to rework on our food pattern, rediscovering our food pattern, so that we don't deviate much. So we go back to our old culture. We try to understand. We should not go away from. Indian system of food is very good. It's a very good balanced diet. To stick to that, follow that, so that we'll be on the safe path. I think these kind of infections are for teaching us to be more aware about what we have to eat.
From an immunological perspective, where do you think Indian kids stand? Do you think that they're better equipped to handle the virus vis-a-vis their Western counterparts, or do you think they're at more of a risk?
As an immunologist, one of my favorite scientific hypotheses of all time is called the hygiene hypothesis, which states that individuals who are exposed to a wide array of pathogens in their early life develop a strong immune system, mainly because they start to train their immune system against different types of pathogens, including viruses, bacteria, fungi, etc. There is now decades of real-world evidence to support this hypothesis, and most relevant to our discussion today, we know for a fact that Indian kids do fight certain infections, including viral infections, better and are relatively less prone to allergies, mainly because we think Indian kids are usually exposed to a lot more pathogens in their early life relative to the Western kids. In spite of this, to date, there is no evidence, and I repeat, no evidence to support any hypothesis around Indian kids responding differently to the coronavirus. So there is no reason for us to think that Indian kids would be more or less susceptible to COVID. Unfortunately, even after dealing with this virus for so long, we still have significant gaps in our understanding.
But Dr. Chai, I wanted to ask you a question about, you were talking about children's immunity, and you made a very interesting point about how younger children, because of the sheer morphology of it and the way their anatomy is structured, they're less susceptible to the virus, COVID. But do tell me, is there any sensibility to try and boost their immunity? Or is that because there are two schools of thought. One is people will tell you that it's a pharmaceutical gimmick, to boost immunity, to take pills. In the West, of course, it's a booming industry where people are on supplements all the time. They take 15, 16 pills every day. They do it voluntarily to keep several levels in check and so on and so forth. We, of course, we have that unave marundu mindset, of course, but though we've evolved in several directions, are we at a point right now where we need to start thinking of giving our kids supplements just to ensure that their immunity is on par, if not better? Dr. Chella, your thoughts?
Yeah. See, we consider immunity as point of discussion for children. See, for adults it's different scenario. For children, say most children are backed up with the parental care. So most time they always get a adequate nutrition. Say for people who are in the move, they may not have adequate nutrition in a proper manner. For children, most time they get a proper nutrition from their house. For people who are really underprivileged and who are dependent on the noon meal food, and in Tamil Nadu, considering the scenario in Tamil Nadu, say they need most underprivileged children are malnourished. Say protein is the important component in food which helps in boosting the immunity. So macronutrients part carbon, protein and fat. Protein plays a major role. So adequate protein intake is the first point for any children to develop their basic immunity. And more say don't load the children with protein, but they need a adequate protein supplement. Call it as say either multivitamins or the say trace elements, which are all which there is a requirement for this thing, because the enzymes need to say set right the immune levels in the system. Say let it be T cell mediated immunity or B cell mediated immunity, whatever the thing happens inside. See, it requires everything has to be put it in our mouth only. So considering the macronutrients they play a major role. Additionally, only the supplements play a major role, say a minor role. All the immune boosting mechanisms, all the herbs we say it can help us to boost the immunity. All the nutraceutical products are the supplements which are going to help the children to boost the immunity. Yes, it's in the minor level only. Scientific evidence, it's very less as of now, but it's coming up in a very big manner. Say macronutrients need to be taken care first. Then the micronutrients such as vitamins, minerals and basic supplements need to be fulfilled for the recommended daily allowance. It need to be there. And beyond that, the herbs. Say we can't load the children with continuously with the herbs to boost the immunity. No, it's not possible and not necessary also.
Is there such a thing as too much immunity?
Say too much immunity is dangerous. Say I will tell you, it's autoimmune disorder. It will turn as, say, immunity has to be in the balance. It's like a say weighing scale. It shouldn't be in the balance. When the immunity goes down, we get more infection. When the immunity is high also, there is a problem that autoimmune situation comes in. Say bronchial asthma is a condition where more immunity is there. Say any rashes or urticaria or skin issues, there the immunity is in the higher side. So these are the situations, and even you can take rheumatoid arthritis, you can take any other disorders where even the immune levels, immune levels are more, it's going to cause damage to our system. For children, it's going to be more dangerous also. So it has to be in balance. So make sure there is no low immunity, make sure there is no high immunity, the balance has to be straight. What to do? The macronutrients are the first component, second is the micronutrients, third is the herbs, which will help, which need to help the children to prevent them from getting the infections in the right time. Don't load them with say continuous supplements. Balance has to be struck in a right manner. Scientifically I am speaking. And there is no scientific evidence that boosting immunity is far different from holding the balanced level is very, very crucial.
I think that's a very honest perspective, you know. Whether it is allopathic, whether it is Indian, whether it's Siddha, Ayurveda, Unani, whatever it is, yes. I think balance is key.
Yes.
I think balance is the key everywhere. And unfortunately, I think balance is also an Indian disease. We take too less, too late sometimes, or too much too fast sometimes.
True.
Professor Natarajan, your thoughts?
Like Dr. Chella said, like the food, the macronutrients, micronutrients, they are very, very important. Like protein, carbohydrate, fat, and then the other vitamins, minerals. Of course, they are the main components of our food. They have to be there. That is why we take not only the protein, carbohydrate, fat, we also take a lot of vegetables and fruits. Because a lot of vegetables and fruits, they have to become the part of the diet because they provide enough vitamins and nutrients as well as minerals. But when they are not sufficient enough, of course, when the people, not taking the balanced diet for various reasons, of course, a multivitamin or multimineral, whatever is promoted these days, can be taken, once in a few days, once in 2 days, or once in 3 days, weekly. So like that, I feel they can become a part of the diet, at least during this situation. Okay? But along with that, some immunity boosting herbs, they can also be taken once in a few days, or at least little bit on a daily basis. I feel that by taking them on a regular basis during this period helps both the children as well as their parents to a reasonably good extent, so that their immunity system it is not becoming less at least. But using these herbal medicines should be in an appropriate way, not too much excess, because even herbal medicines they have to be used cautiously. So either the pure herbs, if they buy it and they have to be processed in such a way that they take enough dose, or if they buy the product they have to know what product they take it. According to the directions given, they have to make use of it.
Going forward, people are talking about vaccination as the only way forward, and medical experts across the board do believe that there isn't really a more viable alternative. When do you think the vaccination load will ever stop? And do you believe that there's ever going to be an end to the COVID pandemic in as much as newer strains and herd immunity? What's your take as an immunologist?
Couldn't agree more, right? Vaccination is our only way out of this pandemic. I know this concept of herd immunity gets tossed around frequently, but what gets lost sometimes in these conversations is that there are two key pillars to achieving herd immunity, which is basically us as at the population level being not susceptible or being immune to the virus, right? We don't get affected by the virus. One pillar is that to have a good proportion of our population being exposed to and recover from the infection. That way, that proportion of the population is not susceptible to the virus. And the other key pillar is actually vaccination. So far, we've never been able to achieve herd immunity against any infection without a successful vaccination campaign. Now, the threshold for herd immunity varies from infection, and for instance, this is over 95% for measles, but only about 80% for polio. For COVID, the general consensus in the field is that the herd immunity threshold is between 80 to 90%, which means that we need to get 80 to 90% of our population either vaccinated or respond to the virus and recover from the viral infection. Now, that's a high number, right? So we unfortunately have to come to terms with the fact that this is not going to end tomorrow. And there is considerable uncertainty still around when it might actually end. Also, importantly, not all communities and not all states will reach this threshold at the same time. In fact, a number of experts predict that this pandemic could actually turn into an endemic, which means that we just have to learn to live with the coronavirus, much like we've learned to live with the influenza virus or the virus that causes the common cold. So our best strategy for now is to follow the guidelines of our healthcare professionals and support our immune system health in every possible way that we can.
Among the SOPs and the various things that the government has been telling us, both the center as well as the state, there are two aspects that they hope that schools can sort of reach these kids. One is, of course, the physical aspect, and that is, I think, somewhere hampered because sports and games have been curtailed, right? Physically, we're not able to do much with them. I mean, we're at a very nascent stage of reopening right now. But I think considering they've had so many months of inactivity, and the fact that they still can't really get on the field, there's no sports happening, there's no games happening. I think parks and gymnasiums and so on are largely still just getting back into the groove, so to speak. So their physical development is sort of hampered. The other aspect, of course, is the mental impact that COVID has had on them. And I think the government has been saying, make sure they have access to counselors and teachers who can advise them to sort of beat depression and things like that. What is the scenario that you have seen, and where do you see this progressing in the next, say, 3 to 4 months?
The point is very right, that we are able to give only the mental solace part of it, and it is not possible to give physical activity at all inside the school premises at this moment, not because of protocol, but to ensure the safety better. Okay, you need to think in that way. Yes.
If you can't have sports without
you cannot. And secondly is that the school environment in Indian scenario is not suitable for COVID protective activities at all. Even the classrooms are designed not for COVID. Okay, so hardly 1 or 2 schools here and there may have, but by and large the old schools which were there for a decade and above will not have such kind of environment. And if you see that even the mental aspect of it, I think all the schools are supposed to have a qualified counselor rather than a certified counselor. Okay, and it is a correct time to take this impetus and drive this. Okay, so all these years we didn't have all these things are fine, but henceforth it is mandatory to have a qualified counselor who can do the job on the floor well. And the job of the counselor is not just to counsel the children, but they need to counsel the parents, they need to counsel the teachers, they need to counsel the children. And there are two types of counseling. One is a group counseling, and another is an individual counseling. Group counseling should be done as a proactive measure to educate the stakeholders, and it should have been done by this time. Okay, if not, we have to organization should catch up and do it. That's a group counseling. And a specific problem faced by a parent or the child or the teacher should also be addressed. Okay, so a lot of investment on counseling must be done. It's need of the hour. Okay, teachers do have problem because they have family issues, and in addition to that they have to handle the class. Okay, household issues are there, family issues are there, and they do have COVID issues, and they all are managing, and that causes stress for the parent, for the teachers, for others. So, and once the counseling part of it is disseminated to the stakeholders, and the stakeholders as a lay counselor, they can take care of large numbers. As a preliminary level, these lay counselors, I am not a qualified counselor, but I am a lay counselor, okay, in the sense that I know counseling a little bit out of experience, okay, time tested, and we grab from others and we try to put it in practice. In the same manner, everybody can become a counselor to a certain extent, and that will reduce the burden on the less number of counselors available in the organizations. So, counselors should create counselors, and that is mandatory. It's not about COVID, otherwise also. Okay, I am not talking about the pandemic period. In general, the school should have this kind of culture.
So, from a children's perspective, as a physician, could you tell us, A, how important it is to vaccinate children?
Yes.
And B, how effective do you think it will be?
Yeah. There are two components in it, very, very crucial. Say, like any other virus, say like influenza virus, COVID virus also has a capability to mutate itself and get into newer strains. Already we have seen 4 strains are already there, Delta plus is there. Few more strains are there, we have not yet find out. So likewise, it's going to happen over next few decades also. But only thing is that making sure every child is vaccinated will prevent them from saving their lives. Every life is precious now, current day. Say, leave it, say government school children or private school children, whoever it may be. Say, now every life is important.
Every child matters, every child, no doubt about it. Yeah.
So, in this scenario, vaccination is very, very crucial. Vaccinating everyone is very, very crucial. So, what happens in most of the Western countries, say US, they have completed more than 80% of people have got vaccinated. But their ICUs are full now. Where is the issue? The remaining 20% of population who are not vaccinated, maybe that out of them also few of them would have got the herd immunity. They got infected and got the immunity by themselves. The remaining people are now in the target people for the COVID-19. So they have opened up everything. They are not doing any SOPs. They are not following anything. Mask is open now. They are free to roam around. And these are the small percentage of people who have made the infection more virulent now. And newer variants will come now. Newer variants will come, newer strains will come up now. Same situation in, say, for the children's. They need to get vaccinated to save lives. And a person who have got vaccinated, there is a possibility they will get infected with newer strains also. And this, over a period of time, we will come into a comfortable mindset that we need to vaccinate now and then. This will happen.
Inevitable. That's
inevitable.
What all medical professionals are saying.
Right. This is inevitable, and this will happen also. And as of now, personally, it's my personal view, getting vaccinated will prevent number of deaths. Say, people will get infected, reinfected, but the same virus, same protein is there already exposed to the immune system. So it can combat even for children.
So the severity of it will be much less.
The inflammatory response will will be less, so that there won't be any death. Even if it is there, it will be very minimal. Then a lot more less percentage than what is happening now. So vaccination is the crucial thing to get save lives for even for children, school going children. So exactly for children less than say 8th standard, we need to wait for the scenario where everyone gets vaccinated properly, then leave them to the school so that they can be a real school. Let it not be a jail for them. And for persons who are in the adolescence, they need vaccination. It's mandatory from my side. I'm talking science. So vaccination will save lives and prevent further deaths because of COVID-19. And newer strains, let it come, but still it can, already they are exposed to a vaccine, the previous strains, so that it will make sure the immune system will be ready to respond to the newer strains also. The impact will be far, far less. So this is one very important point we need to follow, and it might take another about, as of now we have completed about 70 crore people vaccination.
Yes.
It's not possible for 100% vaccination in our country. Say people in the non-reachable area, there are people who are against vaccination also. I don't vaccinate. There are particular group of people there, and this mindset need to be broken. As of a physician, as of a doctor, I just want to convey: make sure each and every human being get vaccinated. Just compare the scenario of polio. So I am a rehabilitation specialist. I have seen innumerable number of post-polio residual paralysis. So if at all the polio vaccine has never been invented, most of us would have been with various severe physical deformities, or even we would have lost life also. So like a same polio virus, COVID is a virus, and with the vaccination we can prevent from getting into the infective, death, to save lives. Say take chicken pox, take smallpox, any other, even yellow fever, Japanese encephalitis. We have got vaccinations, and based on the viral infection. Say bacterial, it's different. So for this, considering this as a very crucial, vaccination is important, and making ourselves immunely stable and balanced with all other South Indian food style. South Indian, we have adequate herbs in our in our environment, and utilize it properly, rationally, to make sure children are they are safeguarded with adequate immune levels, and let us face the COVID in coming years. But as of now, as much as possible, vaccinate yourself, particularly the parents and grandparents. Make sure you are vaccinated before sending your children to school.
The ICMR chief was asked when our first 2 vaccines got approved. There was a lot of talk about why they rushed through the paperwork and didn't sort of wait for months. The general protocol is to 3 months, X number of rounds of clinical testing before it's approved, and there's a pipeline for this. But they pushed this through in a matter of days, especially SII, and they got the approvals very fast, and they started the production line in record time. And the ICMR chief was asked in one of his interactions, they said, how can you justify, negligent medical process in getting these vaccines approved? So he said, in India, it's a matter of numbers. If I want to curb the number of deaths, I give them something with this much of efficacy. If I give this many people, a significant number of people are less likely to die. It's better than giving them a 100% efficient vaccine. I'm giving them a 77% efficient vaccine right now. And in a country like India, I can never hope to hit that 100% in time to save so many people. And I think that has saved lives.
Yes,
definitely.
And I think that's a remarkably progressive approach. And I think we have to have progressive approaches to go forward as well. Just to conclude, Professor, can I ask you, since you're an expert with Indian medicines across the board, could you tell us and tell parents and children and everybody else out there 3 things that they can do if they're infected with COVID, but not severely enough to land them in hospital? 3 things that they can do either at home or through a nominal process to ensure that they make it out stronger. In your experience, 3 things.
So in case if they get infected, if there are symptoms like COVID-19 like symptoms, then they can definitely make use of products like Nilavembu Kudineer or Kabasura Kudineer. Suppose if they have more cough, sputum, then they can go for Kabasura Kudineer. If the fever is high, body pain is more, headache is more, something like that, then they can make use of Nilavembu Kudineer. So they can make use of it. Even there is actually in Ayurveda, there is also Shuddhasana. So Maha Shuddhasana tablet is there, Shuddhasana Churnam is there. They also contain the key ingredients like Nilavembu. Now that Nilavembu, we need to know about it. That actually, whatever the products I quoted just now, The main ingredient is Nilavembu. In Sanskrit, the name is Kalameha, Kalmekh. Kalmekh, because why they kept that name actually, I try to understand that. Mekh means Meham, cloud. Kalmekh means when the cloud becomes black, it means it's a time to rain, right? So those days, our ancestors, they have even given the name to the plant in such a way that how to remember the plant, how to use the plant, when we need the plant. So when it is a rainy season, it means these kind of communicable diseases becomes more chances, right? So especially these kind of respiratory tract infections, like common cold or influenza, these kind of infections, the occurrence becomes more. So they suggested that this kind of Kalmekh, and actual Nilavembu name itself is Kalmekh in Sanskrit. So they can make use of any of these products. For prevention sake, they can make use of even Tipili Rasayanam, Siddha, it is available. Ashwagandha Legam, it is available. Chavanprash in Ayurveda, it is available. They can make use of it on a daily basis, they can give it to the children. Even they can also take it. So for prevention purpose or even for treatment, we have wonderful medicines. People need to be aware of it, they should make use of it, so that not only this COVID-19 or newer strains, we need not even think about it. Even the Nipah virus, it started coming now. Even there is even dengue, we keep reading in the papers, it's again coming back. So any kind of viral infection, the best thing is raise your immunity, so that we become sufficiently immune enough to face any kind of infection. In case if we get infected, of course, according to the symptoms, we need to make use of other medicines also together. Yes.
Fantastic, and I think that's a good place to leave this discussion on a
One
note of optimism.
important point I just want to add on to this. See, what Dr. Natarajan has told, we need to differentiate the COVID infection into different stages. See, in the nasal stage, in the initial day 1 or day 1 to day 3, you can use say Ayurvedic preparations very comfortably, so that it doesn't get into the second stage.
Yes, correct.
So nasopharyngeal stage, these are the places where they can do it at home in itself.
Yes.
There is no need for them to get into.
But once it crosses
the stage, then you require proper medical care to save the life. So initial stage, it's so that everyone can be get acquainted with the herbs and all these things. Get safeguarded in the initial stage itself. That's very, very crucial.
Timing is
essential. Timing is very important.
Well, let's hope we all catch these signs on time. And we hope that we reach a stage where we're able to be back in school, children are able to experience normalcy again. And we really hope that the country and the world is in a healthier place. Hopefully a year or two down the line, COVID will be just like the common cold. I know it's wishful thinking given the year and a half that we've had. But we really hope, and I know that everybody here agrees with me, that the world is a better place, it's a healthier place, and it's a place where children are happy and wholesome again. Yeah. Thank you very much, gentlemen. It's been wonderful having you with us. If you have any questions at all regarding medicine, regarding alternative medicine, Indian medicine, or even the state of schools today, we'd love to take your questions. Do leave us a question on our social media handles, and we'll be happy to answer them for you. Thank you very much. Stay safe, mask up, get vaccinated, and have a wonderful day. Thank you.
Thank you.
Thank you.